the listening and viewing public, and thank you once again for joining us for this COVID-19 update. As always, we'll bring you information from the officials of the Ministry of Health and, of course, the National Security Forces. We welcome with us this evening the Minister of Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre, the Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Letitia Lestrade-Wyke, Principal Nursing Officer Terilia Ravalier, the National Epidemiologist Dr. Shalauddin Ahmed, the Chief Environmental Health Officer Tassle Thomas, and Deputy Chief of Police Lincoln Corbette. We begin, as always, with statistics and surveillance data, and of course that's being presented by Dr. Ahmed.
Thank you, Ms. Harry. Honorable Dr. Irvin McIntyre, Minister of Health, Wellness and New Health Investment, Mrs. Letitia Lestrade-Wyke, Permanent Secretary, Ministry of Health, Wellness and New Health Investment, Mrs. Terilia Ravalier, Principal Nursing Officer, Ms. Tassle Thomas, Chief Environmental Health Officer Acting, Mr. Lincoln Corbette, Deputy Chief of Police, and listeners. Pleasant evening to everyone. The number of confirmed cases of COVID-19 in Dominica remain at 16. The number of samples tested so far is 534. Of them, 518 are negative using the PCR method. At this stage, the testing cohorts include healthcare workers, returnee nationals, and a few suspected individuals. The returnees are at the government quarantine facility and are being tested using PCR methods. Now I wish to present a brief update on our community-based screening. Community-based screening is ongoing. So far, we have completed 72% of the households, and about 800 participants have been tested using rapid test method island-wide. Only 2 were reactive to rapid test. Subsequently, they were negative using confirmatory PCR testing. Hence, it is likely that these 2 individuals developed antibodies to COVID-19. Additionally, we identified a case with fever, but they were negative for COVID. 99% of the participants were non-reactive to the rapid test. So based on the information that are available at this time, it is very likely that there is no community transmission. The La Plaine, St. Joseph, Grand Bay, and Castleblues health districts have completed their allotted household visits. Marigot and Portsmouth health districts are expected to be completed by today. And we are hoping to complete the Roseau health district sometime next week. Early next week, that is. As the Roseau Health District is the largest of them all. In general, the people are very receptive, especially in La Plaine, St. Joseph, and Grand Bay Health District. The response rate from these 3 health districts is 100%. All members of the team were keen to be part of this study, and they volunteered to be part of this study. In most part, they have completed this study on time. A final analysis will be conducted sometime next week. So our active surveillance continues, and the Ministry of Health will keep the government and the general public duly informed and updated. So we are hoping from next week there will be a final analysis and will be reported to the general public. So with this in mind, I thank you and conclude my presentation.
And our thanks to Dr. Ahmed and, of course, his team, who have been very vigorously doing the community testing. And like Dr. Ahmed said, there has been no change in the number of confirmed cases in Dominica. We remain at 16 confirmed cases, none of them active at present. Our next presenter is the Chief Environmental Health Officer, Ms. Tassle Thomas.
Thank you, Ms. Harry. Minister of Health, Wellness and New Health Investment, Dr. Irvin McIntyre. Permanent Secretary in the Ministry of Health, Mrs. Letitia Lestrade-White. Principal Nursing Officer, Terele Ravalier. National Epidemiologist, Dr. Shalauddin Ahmed. Deputy Chief of Police, Lincoln Corbette. Media moderator, Ms. Harry. The listening public, good evening. As you may know, the Ministry of Health has prepared a number of guidelines compatible with that used by the organizations like the WHO, the World Health Organization, and the Center for Disease Control, the CDC, and other countries for the opening of our local economy and the country by extension. The Environmental Health Department is responsible for the monitoring of most of these guidelines. What the Environmental Health Department has done is to prepare a schedule for the officers where we have not only monitoring done in Roseau, but all over Dominica. We have environmental health officers stationed all over Dominica. But what we have found is that in the two towns, where we have a larger concentration of the businesses, we have developed teams of officers to do the monitoring in these areas. So our officers are equipped with the guidelines, inspection checklists as they go out there, doing the inspections first of all, and then the monitoring. And at the end of it all, after the inspection, if everything is in place and you are complying, the business is complying with the guidelines as set up by the Ministry of Health, what we do, we offer you a compliance certificate or a certificate of approval, that is. It is posted in a conspicuous area in the business where everyone is privy to it, everyone can see. Okay, as I go, let me just go through some of the guidelines. I won't go through the entire guideline because some of them are pretty long. But what happened is that the guidelines are issued to all the business places. As I said before, officers go out with copies of the guidelines. They issue to all the businesses so that they can follow these guidelines and put measures in place, all in an effort to prevent the spread of the coronavirus. So these guidelines, as you may have heard the minister uttered earlier this week, we will be having the opening of the restaurant for in-dining or dining in, also the opening of gyms and the opening of churches. And so I have highlighted some of those key areas of these guidelines for these three businesses. So before I get into that as well, one of our shortcomings we didn't anticipate was the earlier on was the Haitian nationals, where we have a lot of them being barbers, and the hairdressers, some of them being Spanish. So what we have done since is have the guidelines translated into Haitian Creole and Spanish to accommodate these two groups. Okay, so as I go through the restaurant guidelines, that is for people dining in. Reservations must be made to avoid crowds congregating. Okay, so you must call, make your reservations, and then the owner will accommodate you accordingly. Tables should be spaced 6 feet apart. If the business cannot maintain the 6 feet distance, they shall operate pick-up only, the pick-up only service. All tables and chairs should be cleaned and sanitized before opening and after use by each client. Do not combine groups. People from the same group can share the same table. In other words, you operate by reservations. You have a group of, say for example, 3 people coming in to dinner, and then another group called another group of 5, but you have decided, okay, I have 5 and I have 3, so and my tables can sit 4. So instead of using another sitting arrangement, let me put this one in the group of 3. No, you do not do that. You do not combine groups. You leave groups by themselves, and you use a new setting for these people. And very importantly, cleaning and sanitizing as you go along. After each group leaves, the tables, the chairs have to be cleaned and sanitized. Okay, so that's it for, these are the key areas for the restaurants. Next we have the opening of the churches. And this is very, very important. And the stipulated date for the opening of the churches, that is May 30, which is tomorrow. The clergy or the minister shall be responsible for the strict implementation of these guidelines. So the onus is on the minister, the clergy, whoever the head of the church is. The adherence to social distancing or physical distancing of the 6 feet for your congregation is critical. People of same household are allowed to sit together. Okay, so if there are persons coming to church, like 3 people coming from a family, they are allowed to sit together. There is no need for social distancing for these people. But once you are from different household, then you have to maintain that 6 feet distance. The number of congregants allowed will be determined by the ability to maintain the social distance of 6 feet. So what we are saying there is that you have a small church. Your sitting might be, your benches might be, let's say, for example, 6 feet long. You don't call overnight and ask whether, oh, my church is small, whether I can have 2 people sitting at a bench and so on. No, that will not be allowed. You have to maintain the 6 feet distance at all times. So bear that in mind. And the onus is on the clergy or the minister to see that the protocols are followed. We know, for example, in most of the Catholic churches, the benches are like 18 feet long. This can accommodate easily 3 persons from different households. So bear that in mind. The number of congregants allowed, ushers should be available to provide direction so as to maintain the 6 feet social distancing. All congregants to wear masks upon entering, and all persons should be allowed to have their hands sanitized at entry and exit. Traditionally, we have the greetings of hugging and handshaking. This will not be allowed, shall not be allowed. Okay? No passing of collection / tithe offering baskets from one person to the next. And it is left to the minister or the clergy to determine this one. Church or place of worship to be cleaned and sanitized before opening and before and after each use. Okay, so these are the key areas for churches. Now, finally, we have the guidelines for the gyms and other fitness venues. Limit capacity based on the space available for social distancing. Set up equipment to provide the 6 feet radius. Okay, goes without saying. Remove excess sitting to discourage lingering in your establishment. Limit patrons by offering an appointment system. Allow 10 to 15 minutes between groups for proper disinfecting practices. For example, if you have a group coming in for 2 hours, just before, maybe 10 minutes before the 2 hours is over, you have to dismiss that group or take them 10 minutes in advance so they can have their fair 2 hours, so that you have the little time in between to disinfect your equipment and other surfaces. Inform clients that they should not share items. Keep doors open as much as possible to allow airflow and to minimize the use of the air conditioning. And very, very important is to establish login procedures for members and employees and maintain that information for potential contact tracing. So the gym, you must have a login system where you allow your customers to log in, write their names, be it a register and so on, where they write in their names, the date they came in and so on, so that in the event they develop any signs and symptoms of the COVID virus later on or the flu, it is very easy to do the contact tracing, you know, who was with them at that time of practice and so on. COVID-19 is a deadly disease, a deadly virus, and it's nothing to play with. So, as I always tell people or the listening public whenever I get the opportunity, we are not and we cannot be everywhere all the time. So we depend on you as our eyes and our ears out there. So you see something, you are not sure, but call us anyway. It's up to us to investigate and to take necessary action. So call us, let us know what is happening if you see something out there. Also, I would like to say that we are not out of the woods. Even if we do not have active cases at the moment, it does not mean that we should let our guards down. We have to continue following the protocols and the guidelines as set out by the Ministry of Health. Thank you.
Our thanks to the Chief Environmental Health Officer, Tassle Thomas. You just heard some of the guidelines for the reopening of businesses here in Dominica. The guidelines may seem extensive, but they are very necessary if we would like to stay protected against this COVID-19 virus. Of course, these guidelines will be made available to the various businesses and the various religious entities. So if you would like those guidelines, feel free to contact the Ministry of Health or the Environmental Health Department specifically. Our next presenter this evening is the Principal Nursing Officer, Terelia Ravelier.
Minister of Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre, Permanent Secretary in the Ministry of Health, Mrs. White, National Epidemiologist, Dr. Ahmed, Chief Environmental Health Officer, Corbette, Moderator, Ms. Sheena Harry, media personnel, listening public, good evening to all. I am here to deliver a brief update on the government-operated quarantine facilities located in Portsmouth. Just to let you know, the public, quarantine continues to serve as a critical public health measure here in Dominica in the prevention of spread of this COVID-19 as the pandemic continues worldwide. We at the Ministry of Health have not been without disruption in the area of quarantine. The Ministry of Health response technical team continues to meet and discuss regularly the new developments as it relates to the pandemic. We are tasked with finding suitable best public health practices for the current situation here in Dominica, as we continue to reassure you, the public, that we will ensure that updated information is given. The current management plan for the quarantine operation. As of this week, persons admitted to the quarantine facility will have a nasal swab test done, which is the PCR testing, on day 4 at the facility. If the test result is positive, this person will be transferred to the COVID-19 isolation unit for onward management by the medical team. If test result is negative, quarantine continues at the facility, and a repeat, which is the second nasal swab test, will be done on day 6. If the repeat test is negative, which should take about 24 hours to obtain the result, hopefully which will be about day 7, the person is cleared for home to continue quarantine for the duration of another 7 days to be monitored by the district team. Previously, we had 14 days quarantine without the testing being done. Presently, I am just repeating that we are going to have 2 tests done, whereby one on day 4, negative result, it is repeated on day 6. Day 7, we obtain the result. If it is negative, persons are to be cleared for home to continue another 7 days. This will assist in the number of days that persons are spent in the quarantine facility. However, if day 7, the test result, or day 6 result is positive, These persons will be transferred to the COVID-19 isolation unit for onward management by the medical team. At this time, permit me to share an overview of the quarantine facilities. From March 21st to today, 29th May, this is 70 days by count. A total of 316 persons have been admitted for quarantine. A total of 245 have been discharged to date. 191 persons from the facilities had a nasal swab done. Today, there are 4 facilities functioning in Portsmouth. 48 persons had a second swabbing test done since the new approach to health management at the quarantine facilities. There were 2 admissions today, and we were pending discharges today. There is a total of 69 persons quarantined. Operation of the facility is done by the nurses and community health aides. Quarantine continues at the cost of the government. Facilities are furnished to the comfort of all persons. Free meals are provided daily. The security continues with great support from the logistics personnel, the police department. Support is also given by the Portsmouth Health District team. No one experienced signs and symptoms of the virus whilst in quarantine. The government, along with the Ministry of Health, continues to demonstrate its high level of consideration to our very own Dominicans who have been stranded abroad, and therefore the quarantine facility is there to facilitate and support persons returning home when it is designated to. To conclude, I urge the persons in the quarantine facility, those listening, to continue to comply and work with the staff. Always be respectful to the staff. Be reasonable with your request that you may have. Adhere to the rules and guidelines of the facilities. And please, refrain from tampering and more so, removing or leaving with items that belong to the facilities. As all items that are made available for use have to be accounted for, as well as these items are needed for use by others. Not only is it our responsibility to serve you, it has become our pleasure to be part of the team caring for you and protecting our country. So we urge you to think of us and think of others who may need these services and these facilities. Thank you.
Thank you to the Principal Nursing Officer, Terelia Ravalia, and of course, thank you to all those who are working tirelessly at the quarantine facility. It is a taxing responsibility, but they continue to do their job diligently. And again, as she said, all those in quarantine, we ask you to cooperate with them as much as possible. Our next presenter this evening is the Deputy Chief of Police, Lincoln Corbette, and I'm sure many people have been looking forward to hear what he has to say about this weekend's restrictions.
Minister of Health, Wellness and New Health Investment, Dr. Irvin McIntyre. PS in the Ministry of Health, Mrs. Wyke. National Epidemiologist, Dr. Ahmed. Chief Environmental Health Officer, Ms. Tassle Thomas. Principal Nursing Officer, Ms. Ravalia. Listeners, good evening. The Command for Dominica remains under state of emergency and curfew remains in effect. There are a number of conditions under the curfew order that must be policed. I'll speak of 3 of these conditions. That is the revised curfew hours, travel restrictions, and restrictions on access to our beaches and rivers, the curfew hours. The Honorable Minister for Health advised recently on new hours to the curfew. The curfew hours are as follows: 8 p.m. to 5 a.m. Monday to Friday, 6 p.m. to 5 a.m. Monday to Sunday. On Monday, June 1st, 2020, curfew shall start at 6 p.m. and end at 5 a.m. on Tuesday, June 2nd. Access will be granted to essential service providers or individuals who have permission from the Commissioner of Police. This will be the first weekend since the state of emergency was imposed that there will not be a total lockdown. Travel restrictions. The borders of Dominica remain closed, and anyone wishing to enter the state must obtain the written permission from the minister. We continue our efforts at securing the borders, and we take all necessary action to ensure compliance. I wish at this stage to thank members of the public for heeding the call to assist the police in identifying people who may have entered the state illegally. Several people have been arrested, taken to quarantine and the courts. Access to beaches and rivers. Access to beaches and rivers is generally permitted Monday to Saturday from 8 a.m. to 5 p.m. However, on Monday, June 1st, residents shall not be permitted to access the beaches or the rivers. Groups of 10 persons or less will be permitted to access the beaches or rivers. No parties, barbecues, or the consumption of alcohol will be permitted on the beaches or at the rivers. Physical distancing must be maintained while at beaches or at the rivers. Any officer of the Command for Dominica Police Force reserves the right to deny access to anyone to the beaches or rivers to prevent a breach of the curfew order. For the avoidance of doubt, I wish to reiterate, residents are not permitted to go to the beaches or rivers on Sunday, May 31st and June 1st, 2020. So no beach going this Sunday and Monday. People who fail to adhere to these conditions or measures shall be dealt with according to law. I wish to take the opportunity to thank and encourage my officers who continue to work very hard towards the task. I also wish to thank the following organizations, individuals, and agencies who have partnered with us throughout. The Honorable Prime Minister, the Honorable Minister of National Security and Home Affairs, the Government of Dominica, Dominica Air and Seaports Authority, Customs and Excise Division, the Aid Bank, Fine Sports Incorporated, the Rotary Club of Dominica, Signman, MO News, Ms. Natalie Joseph, Jungle Bay Resort and Spa, Old Stone Bar and Grill, Springfield Trading, DCP Successors, Beautywise, Josephine Gabriel and Company, LA Enterprises in Portsmouth, Ms. Hazel Thomas, Ms. Beatrice Simon, and Ms. Alex Bud Knight. Your timely contributions to the Commonwealth of Dominica Police Force have significantly contributed to our effectiveness. Therefore, together we will continue the fight against COVID-19. Thank you and good evening.
Thank you so much to the Deputy Chief of Police, Lincoln Corbette. So for those of you who weren't quite clear on what's the rule for Sunday and Monday, although there is no lockdown, you are not allowed to go to the beaches and rivers on those days. And our final presenter this evening is the Honorable Minister for Health, Wellness and New Health Investment, Dr. Irvin McIntyre.
Okay. Before I begin, let me recognize the Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Mrs. Letitia Lestrade-Wyke, National Epidemiologist, Dr. Shalauddin Ahmed, Chief Environmental Health Officer, Ms. Tassle Thomas, Principal Nursing Officer, Mrs. Terilia Ravalier, Deputy Chief of Police, Mr. Lincoln Corbette. Today, it's 7.5 weeks since we've had our last PCR confirmed case of COVID-19. We have continued PCR testing for our frontline workers and all persons exhibiting symptoms which fit the case definition. Thankfully, they all have been negative so far. Such case identification activities will be extended to other high-risk groups to include nursing homes, prisons, and bus drivers. Though case definition, in addition to public health and social measures, is the way to go in limiting transmission, the public participation and adherence to guidelines and measures is of paramount importance. We seek stressing this point because science has proven and the experience of other countries has underlined this fact. The more adherent and diligent we are, the safer we shall all be. Of course, we are fully aware of the difficulties adjusting to the new normal. But the truth is, we don't have a choice. We must protect each other by collectively following all the public health and social measures. Recommendations have been made for the reopening of churches and places of worship from 30th of May in accordance with the issuance of an order by the President. The opening is subject to guidelines issued by the Ministry of Health. Protocols have been discussed and provided to various churches and religious officials. After careful consideration by the medical team as well as by the Cabinet, and taking into account the scientific data available, it has been decided that on Pentecost Monday, that's the 1st of June, persons are allowed in a public place between the hours of 5 a.m. to 6 p.m. However, it has been observed that the recent relaxation in restrictive measures has led to the public letting down their guard as regards to following the public health and social measures. This predisposes all of us to the increased risk of infection. Considering the large number of persons anticipated to access the beaches and rivers on Pentecost Monday, it has been decided that the public is prohibited from accessing the beaches and rivers on Pentecost Monday. It has also been recommended that Sunday will no longer be locked down and curfew hours will now begin from 6 p.m. Normal provisions for accessing the beaches and rivers will continue as mentioned previously, that is normal weekdays and Saturdays. Let me take the opportunity to mention that we will be observing World No Tobacco Day on Sunday, the 31st of May. This year, the theme for World No Tobacco Day is protecting youth from industry manipulation and preventing them from tobacco and nicotine use. For years, the tobacco industry has developed aggressive strategies and tactics, targeting the youth as an emerging and vulnerable market for its addictive tobacco and products. Tobacco is one of the major risk factors for developing non-communicable diseases like cardiovascular disease, cancer, diabetes, hypertension, and respiratory disease. which accounts for the top 5 causes of morbidity and mortality in the population. More importantly, right now, studies have shown that smokers have a higher risk of developing severe case of coronavirus, and people with comorbid conditions are at higher risk of developing severe complications when affected with COVID-19. As a member state, Dominica will adopt the WHO Global Campaign to demonstrate how young people can be empowered to take control of their health and reject tobacco addiction. The Ministry of Health, Wellness and New Health Investment acknowledges that it is the responsibility of all stakeholders to protect the health of the youth, both smokers and non-smokers, from tobacco smoke and tobacco products. The ministry urges the youth to take control of their health and work towards a better and brighter future, building resilience among the next generation of young people against tobacco and moving steadily to a tobacco-free future. Let me also remind the public that hurricane season begins on June 1st. With the COVID-19 pandemic, this poses a new challenge which we should be mindful of. We must take this opportunity and prepare our family plans as early as possible. Our hurricane kit should be well stocked with COVID-19 in mind. Besides the usual that you've been stocking up every hurricane season, there must be additional supplies to include masks, sanitizers, detergents, and medication. Even at our shelters, the protocols and guidelines should be adhered to as much as possible. I would like to express our deepest appreciation to the frontline workers and our district health team, who have all been doing an excellent job with our community testing. All of this data being collected will be used in taking further decisions, including opening of schools, opening of the borders, and relaxation of curfew. We also thank all local businesses for their timely donations so far. We thank PAHO for their continued support with both supplies and technical assistance. Also the friendly governments of the People's Republic of China, the Bolivarian Republic of Venezuela, and the Republic of Cuba. Let me wish everyone a safe and restful holiday weekend. Let us remain focused and continue to do the good work we have been doing so far. I thank you, and may God bless Dominica.
Thank you very much to the Honorable Minister of Health, Wellness and New Health Investment, Dr. Irvin McIntyre. Ladies and gentlemen, before we conclude this evening, I'm going to make a very passionate plea with the general public. As our fellow Dominicans continue to return home, I would like to appeal to the conscience of all those who insist on starting rumors about the new cases in Dominica, and all those who, instead of waiting on the facts, continue to circulate these rumors without any substantiation. And just because you heard it doesn't make it true. And to what end are we spreading these rumors, though? Is it to cause panic, or is it to discredit the hard work of all those who are involved in this fight against COVID-19? At no point during this crisis has the Ministry of Health kept any information from the public, hence the purpose for these briefings. For the past several months, I'm sure you have heard several stories and then they've been debunked. So that should indicate to you that the only sources of information should be the officials. So I'm going to urge you once again to not have your fellow healthcare workers have to respond to questions that start with "I hear." You're taking away time that they need to protect all of us. So on behalf of the nurses, the doctors, the firefighters, the police officers, or the other frontliners, again, there's nothing wrong in not being the first person to share something. Wait until you get the facts. Thank you, as always, for listening, for tuning in. I want to thank the Office of the Honorable Prime Minister for always hosting us so graciously, and to his technical team. Ladies and gentlemen, I wish you a safe Pentecost weekend.